Hello, I am here today to show you how to do feline dental x-rays. Feline dental x-rays are very similar to what we've shown you so far in canine dental x-rays. The big difference is they have less teeth, so there's less views to take. Same techniques are going to happen. We're still going to do the bisecting angle technique pretty much everywhere. So finding your angles and then bisecting that in half. The only better part, like I said, there's less teeth to examine, so there's less x-rays that we can take, so it goes a little quicker. So we're going to start with our cat in ventral position. So they've been anesthetized, they've been intubated, all that stuff. We're going to start with them in sternal position, putting a rolled towel under the head to elevate that and kind of bring it up so it's a little flatter. Your sensor, your digital sensor, you're going to start with the flat side facing up. So we're going to start with the upper jaw first. We're going to insert the sensor into the mouth and basically place it like he's biting on a sandwich. That's kind of how I remember it, is he's biting on a sandwich. Okay. When we do the bottom jaw, you'll see the opposite. We'll roll him on his back and we'll just flip the sensor over so that the flat part is facing the bottom jaw. So to x-ray, we're going to basically do it in 3 views. We'll do one of the upper right, one of the front, and one of the upper left. We're getting the entire quadrant in one shot. So for the upper right, we're going to bring our beam over to that side. Okay, make sure your sensor is all the way back as far as you can, and you may have to slide it to the left just a tiny bit so that it's hanging just outside. The tip of the premolar should be near the edge of the sensor. Then you're going to find your angle. So you're looking down at your sensor and at your teeth, okay, and finding your angle. Now, cats have a really big zygomatic arch, so it gets in the way. Okay, you're basically going to be resting right on it and looking right in their eyeball. Again, making sure that the center of the beam is about at the middle, or in the middle, your teeth are in the middle of the beam. Okay, so you're hitting that at a 45-degree angle. Okay, we will expose. On your control panel, we're going to use these little icons, cat upper and cat lower. So cat upper, if we do that, it sets our KVP and our MAS. So it'll stay this for the entire top jaw. When we move to the bottom, we'll go to the cat lower, and that will drop our MAS just a little bit. So remember, we're going to get 6 feet out of the way. Expose. And then look at our view on the computer. So you can see over here, we have the upper right. Okay, so you have the canine all the way back to the molars. And then you can see that this big white thing here is the zygomatic arch. That is in the way. It's kind of over top of the molars and premolars in the roots, but you can see them through that. I'll do a separate video on evaluating the dental x-rays a little bit better, but you can still see them. I will show you at the very end of these videos a different way to x-ray the upper quadrants, just to kind of move that arch on the back side. Okay, now going back to, sorry about all the jumbliness. Now we're going to do an x-ray of the front canines and incisors. I'll move this a little bit so you guys can see. So, keeping the sensor in there kind of straight, you want to straighten it up so that it's kind of square in the mouth and it's out in front of the incisors just a tiny bit. Okay? Moving your beam to the front, finding your angle. So looking down at the sensor, in at your teeth, and finding that 45-degree angle. And then kind of centering it over the nose. There's a notch in the center of this little cone. I like to line that up kind of with the midline of the cat's head, and that kind of ensures that it's a straight-on view. Cats, canines are not as long as dogs, so they're kind of more straight up in, so we don't usually have as many issues with imaging them and cutting off the roots unless your angling is really off. Okay, so again, we're going to come out of the zone 6 feet away, expose. And then we will look at our x-ray. So we can see here we have both upper canines and all the incisors in one shot. You can see that I have cut off the one canine just a tiny bit. I'm not too worried about that because I will pick that up in my next lateral view. That happens quite a bit, especially depending on the spacing between, or how wide your cat's headed, or how wide the canines are apart. So don't worry about that. Try to get it as straight as you can. This is also a really great view for your sinuses. Cats are very, very, very prone to having sinus tumors. So this is a really good view, and I mentioned that when we did canines, to do that. All right, I'm going to spin this cat back forward a little bit. So now we're going to move to the upper left. So we're just going to move our sensor to the left just a tiny bit, so it's just hanging outside the teeth just a tiny bit. And then again, finding our bisecting angle from this side. So now we're looking down this way, looking in this way. And I'm going to go just a little bit higher. And then again, lining that up over the teeth, making sure that the teeth are about in the center of the cone. Okay, then we're going to step back, expose, and then look for our image on the computer. Okay, so now we have the same thing. The other side, the zygomatic arch is right here, kind of in the way a little bit, but we can still see the outlines of the teeth. Okay, these are pretty much the general x-rays for the cat of the upper jaw or the maxilla. So I will do another session for the bottom mandible, and then I will show you the last view of how you can do the extra oral version of the maxilla to move that arch on the back.